Related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. Our number is 954-717-7027, and we are a Medicare certified home healthcare agency servicing Palm Beach County, Broward, and Miami-Dade. I am your host, Louise Gomez. Welcome to the show. And today I am delighted to interview Dr. Branson Collins. He should be coming on shortly. And Dr. Collins is right here in Boca Raton. The address is, he's the director of the Marcus Institute of Integrative Health. And he is at the Galen Medical Building, 880 Northwest 13th Street in Boca Raton, Florida, 33486. His phone number is 561-566-5328. And let's see, his email, bransoncollins@health.fau.edu. Welcome to the show, Dr. Collins. Thank you for joining us today. I can't hear you. Can you hear me?
I can hear you perfectly.
Oh, perfect. Thank you. Now I hear you. Thank you so much for taking time out of your busy schedule and joining us today. We appreciate that.
It's my absolute pleasure. Thank you.
You know, I was reviewing your qualifications and all about you, and I was just overwhelmed, and because you have such a broad spectrum of knowledge. It's quite impressive. I know that you are triple board certified physician and board certified in anesthesiology, pain medicine, and then anti-aging and regenerative medicine. Is that right?
Absolutely right. I'm kind of a hybrid physician, a little bit of a throwback, but very conventional, and also understanding alternative medicine too.
So, Dr. Collins, can you share with the audience a little bit more about your background? Where did you go to school? Where did you get your experience and your humble beginnings, so to speak?
Absolutely. So I grew up in New Jersey, and I did my training at Rutgers at Robert Wood Johnson. So I did my medical school at New Jersey Medical School in Newark, New Jersey.
Nice.
And I went into anesthesiology at Robert Wood Johnson in New Brunswick, New Jersey. From there, I really decided that I wanted to have more longitudinal care with patients. So I did a pain management fellowship also at Robert Wood Johnson.
So what can you tell us a little bit more about the age range of patients that you treat now? What is the age range?
We have a pretty large age range of patients that we take care of, primarily in the anti-aging and integrative space. We do tend to have a younger demographic that comes to see us. So I do see patients commonly from the ages of 25 through 55, but we do have patients that are 88 years old. We had a patient coming in for IV micronutrient therapy today. So we take care of patients from all ages.
I love that. So it's so interesting. You I guess, we're doing the pain medicine, anesthesiology, and then you decided you wanted to create, like you just said, like a hybrid and expand your patients. Is that right?
Yes. So the background really is that I really wanted to be more integrative in my care with chronic pain patients. So I finished my fellowship in pain management in New Jersey, and I was really looking to help underserved communities in the country. So I decided to practice in Boise, Idaho.
Oh, nice.
We didn't have family in Boise. We had just researched around the country for many years. And what was really impressive about that area is it was very underserved for pain management. So there were only 14 board certified pain doctors in the whole state at that time in 2014. And so I knew I could make a very good difference. Um, what it allowed me to do during that time frame is I did another board certification in anti-aging and regenerative medicine. And that really opened up my mindset for how you can really treat the whole person, even in chronic pain. And on top of that, there's an opportunity to do an advanced fellowship in functional medicine. And functional medicine looks really at the underlying mechanisms by which people are experiencing things like high blood pressure or diabetes. And then it teaches you as a physician how to get to the more root causes to why those things are happening.
That's amazing. What I love about it is maybe they're walking in the door because they're having a pain issue or they're having a challenge that they need resolved. And now you're able to approach it through such a different lens of perspective where you're able to say, well, let's try to get to the root cause of the situation. And so maybe by looking at the root cause, is that helping them to alleviate their symptoms?
Absolutely. And the term root cause is really going around and becoming more popular nowadays, isn't it?
Yes,
And
it is.
and really what we're finding is if you know what to really look for, whether it's signs of low grade inflammation in labs, you can really from there be able to dig a little bit deeper and figure out maybe this person has an underlying nutrient deficiency that's driving inflammation. Commonly in chronic pain, there's a very high incidence of things like vitamin D deficiency. And
Yes.
oftentimes, vitamin D is not tested on standard labs. And because it involves many genes in the immune system, when people are vitamin D deficient, they tend to have more inflammation and thereby more pain.
How can, is there a way that is there a specific symptom where maybe somebody says, wow, I think maybe I am vitamin D3 deficient? Are there any symptoms or anything that would show up for them?
The issue with vitamin D deficiency, as an example, is that it really has multi-symptom presentation. Some people have depression
Oh,
secondary to
wow.
vitamin D deficiency. So if we look at something like seasonal affective disorder, where people get depressed during the winter,
Right.
there's very good associations with vitamin D deficiency because people aren't going out as much, especially in places like Idaho, places
Sure.
like New York, where
Mm-hmm.
it's dark and it's cold. So during that time frame, vitamin D levels drop precipitously, and it could lead to mood disorders. Another thing is chronic pain. If we look at certain literature, chronic back pain in particular is associated with low vitamin D. The real medical necessity that's looked for is if people get fractures. So if somebody has osteoporosis, for instance, and
Mm-hmm.
decreased bone density, and they fall and they get a fracture, that may prompt the physician to check for vitamin D deficiency. The way we work in integrative medicine is we really try to be very proactive about these evaluations, right? We don't want to wait until somebody has the
Right.
pathologic fracture to treat the vitamin D deficiency, right? We don't want to wait until somebody has
Sure.
intractable depression that's not responding to pharmaceuticals to treat the vitamin D deficiency.
I also read somewhere or I heard somewhere that as we age, our body does not metabolize the vitamin D from the sun as much as when we were kids. So some people, like we're here in Florida, some people say, well, I live in Florida. I get the sunshine all the time, right? But it's amazing from what you're telling me. It seems that a lot of people can be living in Florida and still be vitamin D deficient. Is that right?
It is correct. And one of the reasons is in order to really convert vitamin D from sunlight, into active form, we really have to have about 45% of our skin exposed and not have sunblock on.
Wow.
Right. So, I mean, how many times are
Right.
people walking around in a bathing suit without sunblock, right? I mean, there's a risk
Sure.
with over sun exposure. So that's why it's important to ask for measurements. And
Mm-hmm.
and I usually recommend people measure at least once a year. And then one important point that I want to mention is it's not just being about normal for vitamin D, as we're using that example. It's about being optimal. And
Yep.
optimal levels will be between 50 to 80
Oh,
on lab
okay.
work.
So I think it's something that sounds so simple and so many people are walking around and not realizing it. So thank you to doctors like you who are raising the awareness of simple things can change your reaction drastically. And also what I love about what you do is you treat the whole body, right? Because it's not just one part of the body or the other. It's a system, right? So it's like all these systems are interrelated. And so seeing a doctor like you, you're able to go through the whole different body system. You know, maybe it's not just your back that you're having pain, but now you're able to assess the patient in such a different way. So thank you for doctors like you who are doing this type of work and
I
really
appreciate it.
and really bringing to the forefront, you know, an awareness of there's more to it than just that, you know, treating the pain, you know.
Very much so. And there's very close connections with different organ systems. You know, for instance, if the immune system is not functioning well, oftentimes the gastrointestinal tract is involved and the nervous system is involved. So if you work along those different concept of things like triads in functional medicine, gut, brain, immune is a triad that's very intimately tied. And if
Yeah.
you fix one, you can help the others.
Yeah. Can you give us an example or a story of maybe a patient that you had that came in with one situation and they left, I'm sure, totally changed by your treatment? Can you give us an example of maybe a success story in your practice?
I'd love to. So,
Thank you.
one example I'd like to go into is a referral that I got from the Cleveland Clinic. So, you know, I'm licensed in multiple states: Ohio, California, Texas. I have patients from all over the country that see me. And this particular patient had really intractable low thyroid. So, they had hypothyroid, and their endocrinologist was having difficulty with controlling their thyroid, even with medication. And this person heard about the Marcus Institute and found out about me. And when I evaluated them, one of the things that I noticed is that the adrenal glands were not being addressed in this patient, and that's the stress response. And oftentimes in traditional medicine, we can sometimes get very focused on just the problem at hand and sometimes forget the pathways by which underlying things can happen. This person actually had a history of childhood trauma. She had a very stressful life, and I'm very well versed at measuring cortisol levels, and I know from my training that cortisol can impact thyroid status. And oftentimes, if somebody's thyroid is going all over the place, it's not that they're not on the right pharmaceutical; it's that their stress response is probably not very well managed, right? So one of the things that I did for her is I did an objective measurement of salivary cortisol, and I objectified that, and I showed her that her nighttime cortisol was very high. The issue with nighttime cortisol being high is that it actually promotes autoimmunity.
Oh, interesting. We're going to take a quick commercial break. When we come back, we're going to continue. I'm liking this. I'm liking this information. We'll be right back. Thank you.
Thank you.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Thanks for tuning back in to another episode of You and Your Doctor. And today we have Dr. Branson Collins right here locally at the Galen Medical Building at 880 Northwest 13th Street in Boca Raton, Florida, 33486. His number is 561 566 5328. Thanks for coming back, Dr. Collins. So we were discussing, if you can remind me, you were sharing with us I'm trying to remember what we were discussing, if you can
Yeah,
remind
so
me.
it was a referral from the Cleveland Clinic for
Yes,
hypothyroidism. And it was,
yes.
hypothyroidism in the United States is oftentimes the immune system attacking itself. So it's actually an autoimmune phenomenon. And
Okay.
what we do know is that in autoimmunity, the gastrointestinal tract is playing a role. In addition, things like chronic stress and triggers can play a role. So in that case I was discussing, the difficulty that they were having with the person's thyroid control was really because her gut was very inflamed and she wasn't eating well. She was consuming a lot of things that were actually driving food allergies, which was contributing to inflammation. And she also wasn't really doing anything to control her stress. So in counseling her, one of her biggest remarks after our visit was that she was just happy that I'd listened to her. She had gone to about 20 different physicians and felt like nobody's really listening to her and that everything was quote unquote all in her head. And what I did for her is I really did advanced testing in functional medicine. I checked her cortisol levels. I checked for signs of GI inflammation, and I identified she had both of those. And she also had some nutrient deficiencies that were driving some of her anxiety. So I treated her, I optimized her vitamin D status. We optimized her B vitamins. I
Nice.
got her onto a fasting program to assist with just clearing out
Sure.
clearing out the metabolism.
Yep.
And I actually got her onto a very good supplement called phosphatidylserine, which is evidence-based for assisting with nighttime cortisol being elevated. And then it was remarkable. Within about 6 weeks, we had our follow-up, and she was almost tearing up with how much she felt better. She had energy again. Her anxiety was improved. She had even started exercising and had the motivation to exercise.
Dr. Collins, the most impressive thing that I'm hearing is you were able to analyze something, and it seems like you just did these simple tweaks: diet, changed certain things, the fasting protocol, add a supplement. It's like those things, they seem simple, but yet so profound that they changed her whole outcome. And so many people are going to doctors, and what they're doing is they're just putting a Band-Aid on the problem and alleviating the symptom, but not the root cause. Again, root cause medicine. So on behalf of so many of us patients out there, these are the types of doctors that we're looking for. We're wanting someone to go a little deeper, and then it wasn't such a major change. Sounds like these tweaks that you made, and she's probably feeling amazing, right?
She's
So,
feeling amazing. Her family is noticing the difference. She's got that, even her skin and her hair is improved. Her glow is better, and all of her friends are asking her, well, what's different? And she pretty much tells them that her life is just moving in the right direction now, and she has hope, which is the big thing. When I
yeah.
saw her, I wasn't discounting anything she was saying. I listened. I don't know it all, and the patients oftentimes know more than the doctors in terms of what's really happening. It's our duty as physicians to really listen. And by listening, you can really get to the diagnosis and get to the root of why things are happening.
Can you speak a little bit into your vision for integrative medicine and how that will be affecting functional medicine and medicine of the future?
Absolutely. So really right now, I think that what happened with the recent pandemic is that people did realize that a more whole person approach may improve outcomes. And part of what we're doing in integrative medicine is we're really going back in medicine to a time where the doctor really knew every single system that the patient was coming in with. The doctor knew about the heart, knew about how that was interacting with the gut, knew about the family, the social factors. And And what that kind of medicine does is, by really looking at the whole person again, you're able to really get to better outcomes. So what I'm finding now with the use of functional medicine is really the why in medicine.
I
So
like
instead
that.
of it being a mystery, there's certain testing that, with full disclosure, some of these tests are not cleared by the FDA in particular, but they're not. But they're looking at biochemical processes that we know well in medicine, we know well in science, that are well evidenced. And by using this information like genetic testing, you can be very personalized in somebody's ability to tolerate medicines. Doing nutritional testing is just not looking in blood, also looking intracellularly to see what the cells are getting. So you get objective data. And what we're seeing with the future of all this is that the body's been designed to heal itself, right?
Yes.
We've known this for a long time. And that's where, with my board certification in regenerative medicine, is really most exciting for me. And what I'm finding now in this regenerative medicine space is a lot of people are looking at buzzwords like stem cell therapy and PRP therapy. And what I'm finding is, even in people who are practicing regenerative medicine, they also are not really doing it with a whole person approach. And when you do integrative approaches, you help people with their diet, you look at the mind, body, spirit of everything, and then you do the regenerative therapy, people just do so much better. And that's what really makes our practice stand out, is that if people are getting a very comprehensive evaluation when they come in. And we may have an athlete that comes in because their knee is bothering them. And I'm actually talking to them about their diet and how much protein they're getting, are they sleeping well? And to make sure that they're set up appropriately, that if I do draw some cells and I inject into the knee, they do a lot better. And the same thing happens with the 75-year-old that wants to get back on the pickleball court.
So you do stem cell or PRP at the clinic?
We do, yes. I'm
Oh.
an expert interventionally. So one of my background with anesthesia is we're experts with ultrasound and the use of ultrasound injections. I'm also a spine specialist. I do minimally invasive spine procedures,
Nice.
and I do musculoskeletal injections, elbow, knee, hip, and I'm doing a lot of self. It's autologous, so it's using the person's own blood and stem cells to treat them.
So a quick question. Let's say you have somebody who's 75, 80 years old. Are their stem cells going to be as effective, or are you needing stem cells from a donor?
So we'll keep it really on board by saying that really what's on board is autologous, meaning you're taking it from the person.
Okay.
If you have an 80-year-old person, that's what I was speaking of before.
Right.
In order to really make their stem cells work well for them, in my clinical opinion,
Right.
you really need to optimize their inflammation first,
Makes sense.
right? So if they're insulin resistant, they're diabetic, I
Right.
work on that first. I help them with that first, and I can help with that. I can help really improve what we're doing traditionally for that, with things like nutrient therapy. Chromium deficiency is in diabetes, magnesium
see.
deficiency in diabetes. So I check for these things and I improve that. And you improve this inflammation before you do the regenerative injection, they do a lot better.
Oh, that makes sense. So you optimize the person, and then you're able to do the stem cells. Wow, wonderful. Dr. Collins, we have 2 minutes left. If you want to share with the audience, I don't know if you want to share what you think, any piece of advice, or anybody listening right now, how can they optimize their health, or what type of advice would you tell somebody listening right now?
So important things, I think the pillars of health, I really do encourage people to really think about clean air. Looking at air quality of their home is very important. Making sure their filters are getting changed out in their home, having their HVAC systems evaluated to make sure they don't have mold in their home. That's a big issue in
Yes.
Florida. Clean water. Like, are we actually drinking filtered water? Are we drinking enough water so that helps us detoxify? It's one of nature's ingredients, right? It's
Right.
simple.
Right.
And clean food. Are we eating a lot of processed food that's in a box and made in a factory? And if so, can we start transitioning into food that's been grown from the earth, right? That's actually had natural sunlight hit it, and is fortified with nutrients. And then also on top of that, really asking their physicians and practitioners to really do nutritional testing to make sure that they're optimized. And then if they have nutritionists in the practice, can they have a conversation with them and do a consultation? And I think these things can be very helpful to really get people moving in the right direction.
Thank you so much. We appreciate that, right? It's like back to basics. Everything our grandparents taught us, fresh air, clean water, clean food. So it sounds tried and true. So we thank you so much for sharing all of your knowledge, your experience. Thank you for being on the show. And one last time, I'm going to give everybody his phone number. Please reach out to Dr. Collins at 561-566-5328. And he's right here at the Galen Medical Building, 880 Northwest 13th Street, Boca Raton, Florida, 33486. Thank you so much. We appreciate you taking your time out of
My
your
pleasure.
schedule.
Let's do it again. Thank you.
Okay, absolutely. Have a great night. Bye.
Thank you. Bye.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422